All right. Good enough. Hi, good morning.
Good morning.
All right, should we take a look at the day?
Sure.
How are things looking?
It looks good today. Dr. Joe is on call, and it looks like we still have 2 same days available this morning. This afternoon we have 3.
Great.
And all of the providers are here, plus 2 additional PAs.
Great.
We do have support this morning. We have half a day support in the afternoon.
Great. All the medical assistants
all
are here?
All the medical assistants are here.
All right, good. I had a meeting that was on the books for 11:30. That's going to be, I don't have that anymore, so I shouldn't have any restrictions on the morning. Shall we take a look at the schedule?
Yes.
All right, who's up?
So first thing this morning we have Mrs. Smith. She's coming in for a physical, and she's due for mammo, so I will put a slip on the front of the chart for that. Also, she was a smoker, so I will ask her about her smoking status.
Good.
She also had a SIG last year. She's due for fecal occult blood. I don't see one in her recent labs.
Okay, take a peek for that. If you see it, that's great. If not, if you can put the lab on the chart. Fantastic. What's next?
Mr. Wilson is coming in today for his diabetic follow-up.
Right.
Looks like he does have a current A1C at 6.7 this time, and I will make sure all of his medications are up to date and ask him if he needs any refills.
Great, that'll be helpful.
I looked inside of his chart, and he looks like he's due for a Pneumovac, so I'll update that with him, and if he hasn't had one, I will give him that injection.
Okay.
Next thing
is he due for, has he had a monofilament?
He has not had a monofilament in the recent 6 months to a year, so I will make sure I check that and do that for you.
Okay, so
I have the monofilament tool right here, and we'll use that.
Okay, so just check that, put that on the chart, put it on the chart when you're done, and if there's anything that I need to follow up on, I'll go from there.
Okay.
If not, we've got a good screening. What's next?
We have a same day that was booked this morning for Mrs. Jones. She's coming in for some back pain.
Right.
I also checked her chart. Looks like she's due for a pap smear. She hasn't had one in the last year.
Okay.
If time allows us to, I will set that up for you.
All right, that would be great. So if the pap smear is due, if we can pull it off, that's fantastic.
Okay.
I'll let you be the judge of our timing. We'll try to do it for her, but if the day falls apart on us, we'll reserve the right to do that at another time.
Sounds good.
Anything else?
Yeah, Mr. Falls is also coming in this morning. He normally comes in with his list, and so I will try to ask him exactly what we can take care of today that is most important to him.
Good. I think that'll be real helpful with him. He tends to seemingly have a pretty dissatisfying visit, both I think for us as well as him. And as you say, comes in with a pretty extensive list.
Okay.
So if you can really try to focus him today by getting at asking him what exactly he'd like to try to make sure that we accomplish today, I think that'll help keep us on task and help have him leave a little more satisfied. Good. Anything else?
No. As the same days keep filling up, I will update you, and we'll go over that at that time.
That sounds great. So we'll check in at the end of this session just to make sure things went well, make any online corrections we need to, and then get back in touch at the afternoon session.
Okay, sounds good.
Thanks a lot.
Thanks.